Welcome to Therapy Facts with Dr. Jenn. Today we are talking about the interview at Club Shay Shay between Shannon Sharp and Amanda Seales. The interview revealed that Amanda has been diagnosed with autism spectrum disorder very recently, and that she is trying to learn as much as she can about the disorder so that she can learn how to navigate her life a bit better. She shared a lot of episodes of difficulty in social situations. So, point 2 in the series is difficulty with communication. If a person with ASD experiences difficulty with social cues and social interaction, you can only imagine that they experience difficulty with communication, since communication is highly social. So, in the Shannon Sharp interview, Amanda approached the interview in such a way that it made Shannon feel uncomfortable, even as she stated that her effort was to make him comfortable. And in that interaction, that set up a pretty bumpy communication between the two of them for the first third of the interview. Shannon was triggered. He was put on guard, and he did something that he rarely does, which is continuously question a guest's description of their life experience. And Amanda's reaction to his questioning was to be defensive herself. So she, in some ways, mirrored what Shannon was doing, and she spoke up, which she does, and she asked Shannon to allow her to have her perspective and for him to refrain from questioning her, which he typically does not do. And he came back at her and said, "No, I'm going to keep my perspective because you're going to keep your perspective." What was happening in that exchange was that Amanda was asking Shannon to do something that she was not willing to do. She was not able to see that had she acknowledged or provided validation for Shannon's perspective, and then reasserted her perspective, then the communication exchange would have gone more smoothly. So, for example, when she shared about her teacher's reaction to being questioned and her experience of that as racism, and Shannon came back and said, well, maybe that was just an adult putting a kid in a kid's place. She then asserted herself as an expert on African American history and racism, versus saying to him, you know what, Shannon, I definitely see that as a possibility. However, and this is how I took it. Now, how I took it might not have been universally correct, and it may not even have been what the teacher intended. But this was my experience based on my lens, my experiences in life, based on my lens coming up, and even based on the education I received since then. However, it is definitely a possibility that your perspective is accurate. And then that would have smoothed out the communication exchange much quicker. As the interview progressed, she was able to back up and not be so determined to communicate the prominence or the priority of her perspective. A couple of times she was able to say, okay, right, that wasn't validating him. And in fact, she probably didn't even mean it as a way to straighten out the communication, but simply pulling back a little bit. One for you, one for me, two for you, two for me, right? Being able to pull back from her insistence about her communication allowed for the communication exchange to smooth. And so, people with ASD, a hallmark of the disorder is that people have communication challenges of all sorts. What I just described and observed came from Amanda herself. As the adage in the field says, if you've met one person with ASD, you've met one person with ASD, because the symptoms come in a syndrome, they come in a spectrum, which can be different for each individual person's experience. However, communication challenges are a hallmark of the diagnosis of ASD. And so, again, as we talked about earlier, treatment for communication challenges is, again, skill-based. Amanda can be taught how to communicate in a back and forth exchange without her necessarily understanding why that's necessary or even agreeing that it is necessary. But again, the point of it is so that she can have smoother communication interactions with people, so that she can have a choice to whether she wants to have a smooth communication or she wants to have a bumpy communication. Right now, she doesn't have enough self-awareness or skill set to be able to choose. However, she can learn to communicate in a more smooth manner so that she can choose whether she wants to or not. And again, this is the approach for intervening with folks with ASD who have communication issues that are like Amanda Seals.